Hello everyone, I am Dr. Radhika PM, Associate Professor from Ramaya Medical College. Today we'll be discussing about the clinical anatomy of arteries of lower limb. Disclaimer, all the images and videos used in this presentation are from the textbooks of anatomy, various internet sources. The images are used for teaching learning activities only. The video is done to help the undergraduates understand the clinical anatomy. I acknowledge the ownership of the images and give complete credit to them. Coming to the specific learning objective, the student should be able to describe the clinical anatomy of arteries of lower limb. Coming to the first clinical case, a 60-year-old male chronic smoker and diabetic presents to the OPD with the pain in the left thigh and calf while walking, which is relieved by rest. He also complains of coldness of the foot and occasional numbness. So here the important key points which we have to notice is an old man who is a chronic smoker and diabetic. He has pain while walking, which is relieved by rest. Now, this is called as the intermittent claudication. On examination, the femoral pulse is feeble on the left side and the distal pulses are absent. So, what is the provisional diagnosis and what is the reason for the intermittent claudication? So, it is the peripheral arterial occlusive disease, mainly involving the femoral artery here, because the femoral artery pulsation is very feeble and distal arteries are almost will not be able to feel for the pulses. So what is this intermittent claudication? It is a cramping pain in the muscles of lower limb which occurs during the exercise and relieved by rest. The main reason for the intermittent claudication is inadequate arterial blood supply to the muscles of the lower limb. So, this peripheral arterial disease is commonly seen in diabetic and also in chronic smokers. So, those are the predisposing factors for the peripheral arterial disease. So we will learn about the anatomy of femoral artery. Femoral artery, it is a continuation of the external iliac artery and it enters into the femoral triangle. From femoral triangle, it enters into the adductor canal and through the fifth osteoaponeurotic opening, that is the fifth opening of the adductor magnus, it enters into the popliteal fossa as popliteal artery. So the termination of femoral artery is it continues as the popliteal artery. So we will know the surface anatomy of the femoral artery. So femoral artery pulsation can be felt at the mid-inguinal point. Now what is this mid-inguinal point? It is a midpoint between the anterior superior iliac spine. So here you can see this is the anterior superior iliac spine and here you can see this is the pubic symphysis. So between the anterior superior iliac spine and the pubic symphysis, midway between that is the mid-inguinal point. So we can feel for the pulsation at the mid-inguinal point against the head of the femur and the tendon of the psoas major. The bilateral absence or feebleness of femoral pulse can be a result from the coarctation of aorta. So this is the normal aorta and here you can see there is a narrowing of the aorta which is called as the coarctation of aorta. So in this case, if you see, there will be bilateral absence of or feebleness of the femoral pulse. Femoral artery is the common artery which a stab wound at the apex of the femoral triangle may cut all the larger vessels of the lower limb, which includes the femoral artery, femoral vein and also the profunda femoris artery. This leads to the fatal hemorrhage. What are the other importance of the femoral artery? Since the femoral artery is quite superficial in the femoral triangle, it is used for the collection of sample, mainly the arterial blood sampling, which is used for the arterial blood gas analysis. It is also used for the interventional procedures like cardiac catheterization. So this procedure is in which they pass the catheter to visualize the coronary artery. So it is called as the cardiac angiogram. Now, during these procedures, the wrong placement of the femoral artery can result in injury to the femoral vein. So, we have to know the relation of the femoral vessels. So, femoral, if you see from lateral to medial, so first structure which you see is the femoral nerve, then is the artery and vein. So femoral vein is present medial to the femoral artery, whereas femoral nerve is present lateral to the femoral artery. So if there's an injury to the femoral vein, this can result in hematoma, whereas if there's an injury to the femoral nerve, this can result in the weakness of the quadriceps femoris, because femoral nerve supplies the quadriceps femoris. Next, coming to the profunda femoris artery. This artery is a branch of femoral artery. It is prone to injury in case of fracture of femoral shaft because of its close proximity. Next, coming to the second clinical case, a 45-year-old male presents to the emergency department after the road traffic accident. He sustained a posterior dislocation of the knee joint. So, there's a road traffic accident and the person has sustained a posterior dislocation of the knee joint. On examination, there is a severe pain and swelling around the knee joint, and there's an absence of dorsalis pedis artery and posterior tibial artery. So, which is the structure which is injured and what is the anatomical basis of it? So, the structure involved is the popliteal artery, which is commonly injured following the posterior dislocation of the knee joint, because popliteal artery is fixed at 2 points. One is at the adductor hiatus and the second one is under the soleal arch. So, it is more prone to get rupture during the posterior dislocation of the knee joint. Next, coming to the origin and termination of the popliteal artery. Popliteal artery is a continuation of the femoral artery and it divides into anterior and posterior tibial artery. We will know a little bit about the relations of the popliteal artery, which is important for you all. So, in the upper part, if you see from medial to lateral, so first structure is the popliteal artery. Next, you will see the popliteal vein and then the sciatic nerve. So, in the upper part, it is AVN. Whereas in the middle part, from superficial to deep, it is nerve, vein and artery. And whereas in the lower part, from medial to lateral, it is nerve, vein and artery. So one thing which you have to remember here is the nerve which was lateral crosses over the popliteal vessels to come to the medial side, and popliteal artery which was present on the medial side will pass underneath it to reach towards the lateral side. So there's a crossing of this nerve and the artery over the popliteal vein. Next, coming to the third clinical case, a 45-year-old male complains of swelling on the back of his right knee joint and he visited to the hospital. On examination, there was a midline pulsatile swelling. So, what is the probable diagnosis? So, a midline swelling in the back of knee, the most common reason is popliteal artery aneurysm. It is an abnormal pulsatile bulge which is present behind the knee joint. When it ruptures, its primary danger is formation of blood clot that can block the blood flow to the lower limb. And the second complication of this is this can lead to amputation of the lower limb. So one more clinical importance of this popliteal artery is pulsation, how to feel for the popliteal pulse. To feel it, first you have to ask the person to flex the knee to relax the popliteal fascia. Then you have to place the fingertips of the hand in the popliteal fossa with the thumb resting on the patient's patella, and with the fingertips you will be able to feel for the popliteal artery pulsation. Next, coming to the fourth case, a 23-year-old military recruit presents with a severe pain in the front of the right leg after prolonged running. So, he is a newly joined military recruit who has severe pain following prolonged running. So, he has developed progressive tightness and swelling over the anterior leg. On examination, there was a swelling of anterior compartment of leg which increases on passive plantar flexion of the foot. So what is the diagnosis? So this condition is called as the anterior compartment syndrome, or also called as the shin splints. It is also called as the Fresher's syndrome. This is mainly because of the overexertion of the muscles of the anterior compartment when an untrained person is made to run for a long distance. So you can see here there is a swelling of the limb because the anterior compartment it is because of the overexertion of the muscles of the anterior compartment. So because of this overexertion, there is impaired venous return which can result in the compression of the anterior tibial artery, this leading to ischemia and pain. So first there is an overexertion of muscles of anterior compartment. This results in the decreased venous return, and in turn what happens is a compression of the anterior tibial artery causing ischemia and pain. Next, coming to the dorsalis pedis artery. It is a chief artery of the dorsum of the foot. It's a continuation of the anterior tibial artery. And this anterior tibial artery continues as the dorsalis pedis artery. It runs between the extensor hallucis and extensor digitorum. So if you have to feel for the pulsation of the dorsalis pedis, you have to place two fingers between the first and the second metatarsal bone. So dorsalis pedis artery is commonly used for peripheral artery pulsation whenever you have to, like when we are examining a diabetic patient, the common pulse along with the radial pulse, we will check for the dorsalis pedis artery. The next artery where you will feel for the pulsation is the posterior tibial artery. It's it's a branch from the popliteal artery and it runs along with the tibial nerve, and it lies underneath the flexor retinaculum, and it divides into medial and the lateral plantar artery. So posterior tibial pulse is felt against the calcaneum about 2 centimeters below and behind the medial malleus and in front of the medial border of the tendocalcaneus. So this is the place we will feel for the pulsation of the posterior tibial artery. So to summarize, today we have learnt about the applied anatomy of the arteries of the lower limb, mainly the femoral artery, the popliteal artery, anterior tibial artery, posterior tibial artery, and also about the dorsalis pedis artery. Thank you.